Hi guys, this is NetCuterberry and welcome to my channel. In today's video, we're going to be discussing our muscarinic and adrenal receptor types, location, and functions in the autonomic nervous system, or ANS. And we're going to end by discussing about our catecholamines, which are epinephrine, norepinephrine, and dopamine. Think of this video as a basis to understanding ANS pharmacology. Okay, I believe that once you have the receptor types and the locations down, the pharmacology comes more easily. Okay, so let's get into this. Remember, your ANS has two major divisions. It has parasympathetic branch and then a sympathetic branch. Parasympathetic is your rest, digest, and I like to add go to pee. So rest, digest, and makes you pee. Sympathetic is your fight, flight, fright response. And we're also going to be looking at dopamine, a specific receptor of dopamine called D1 additionally. So in your parasympathetic, we have our muscarinic receptors, our M1, M2, M3. We also have nicotinic receptors, which we would not be discussing in this video. Keep in mind that nicotinic receptors are ligand-gated ion channels. We have NN and NM, NN in the brain, NM in the neuromuscular junction. Okay, so coming back to what we will be discussing, we're going to be discussing the muscarinic receptors. We'll also be discussing our alpha and beta receptors in the sympathetic division of the ANS. And the first thing is to understand what type of receptors all of these are. Keep in mind that all of these receptors that you see here are all GPCRs, or G protein coupled receptors. But to understand what specific type, there's a little trick. All our beta receptors, so beta 1, 2, and 3, are all GS receptors. If you remember, GS receptors increase cyclic AMP in the cells. Dopamine 1 receptor is also a GS receptor and increases cyclic AMP in the cell. Okay, so that's the first trick. The next trick is the M's and the alphas go together. So and the 1s and 3s, so M1 alpha 1 and M3 alpha 3, they're all GQ receptor type. If you remember, GQ receptor types use IP3-DAG signaling, and they increase intracytosolic calcium levels in the body, in the cell. Now we're left with M2 and alpha 2. The 2s are inhibitory, so they're GI, and if you remember, GI work opposite to GS, so they decrease cyclic AMP or second messenger levels in the cell. Okay, so that's your overview. If you remember this trick, it should be a little easier to remember the receptor types. Sorry about that. Okay, so next we're gonna look at the location for each of these receptors. We're gonna start by talking about our parasympathetic branch. There's a little tiny trick to remember the parasympathetic receptors, and how you do that is we're going to use blue for parasympathetic. Remember, M1 in the brain, so brain, most important organ, I guess. And then M2 in the heart's the second most important, debatable. And then M3 everywhere else in the body, right? M1 in the brain, M2 in the heart, and M3 everywhere else in the body. So M1 functions mostly towards brain excitation, helps us form memories, long-term potentiation, etc. in the brain. Let's start by looking at the heart. So we said M2 in the heart, right? Parasympathetic branch of the heart, going to the heart, has a negative chronotropic and inotropic effect on the heart. Okay, so there's a negative chronotropic inotropic effect. It would decrease the heart rate. Okay. Let's look at the lungs. M3 everywhere else. Remember, when you think of parasympathetic, there is a visual imagery that I would like you to think of. Okay, and it's going to help us with the eye stuff, and we'll be building up to that in a minute. Think of a person sitting on a couch with a bulging belly, and they're stuffing snacks in their face, and they're watching TV, which is not too far from them, maybe like 5 or 6 feet away. And halfway through the movie, they get up, go take a pee, and come back and continue to watch the movie. Okay, So keep this kind of visual imagery in your mind. This kind of helps you really remember the functions of the parasympathetic. So if the person's just sitting on the couch and watching TV, they don't really need to use the lungs to full capacity, right? So we can so parasympathetic bronchoconstricts because we're not using our lungs. We don't need the lungs to be bronchioles to be fully dilated at this point. So we're good with just bronchoconstricting our lungs. Coming to our blood vessels, there's no intrinsic parasympathetic activity on blood vessels. However, let's just put this in brackets and put a question mark here. There are some M3 agonist drugs that have proven to show some amount of vasodilation. But like I said, no intrinsic parasympathetic activity, so we'll just leave it there. Pee. Now, parasympathetic wants to make you pee, right? The person watching the movie gets up halfway, takes a pee, comes back, right? So what parasympathetic does is it contracts your detrusor muscles of the bladder. Okay, it basically squeezes your bladder to push out the pee. Okay, so it helps contract the detrusor muscles. And again, this is M3. Coming to our eye, again, we know it's going to be M3 again. So in our eye, the parasympathetic affects two different muscles. Okay, the first one is it affects the ciliary muscle. And by contracting the ciliary muscle, it helps us increase the outflow of aqueous humor. Okay, it helps us increase the outflow of aqueous humor in the eye. Okay, this can be a potential treatment for someone who has glaucoma. So one of the drugs you could give is probably an M3 agonist in the eye. Another thing that M3 does is it contracts my sphincter pupillae, which is this muscle here, the purple one. Sphincter pupillae, when it contracts, it causes meiosis or pinpoint pupils, so small pupils. Okay. And so that's something we see with parasympathetic. And the third thing we see with the lens, it gives us a nice and bulging lens, just like the bulging stomach of the person sitting on the couch, right? It gives you a bulging lens. And the TV, remember, is not too far from the person. So this bulgy lens is pretty good for near vision. Okay, so that's what you want to remember with M3 in the eye. Okay, and it should make sense because remember, M3, what type of receptor is it? It's a GQ. What does GQ do? It increases intracytosolic calcium. Why do we need calcium? For muscle contraction, right? So it's contracting the ciliary muscle, it's contracting the sphincter pupillae. So hopefully that makes sense. And there's not really any, we won't be discussing any parasympathetic to the kidney. Okay. Let's start by discussing our sympathetic division and the locations. I don't really have a trick to memorize all of the sympathetic receptors, but there is a little trick here, is that you have one heart, so beta 1 on the heart, and you have 2 lungs, so beta 2 on the lungs. Just something small, but whatever helps. So going back to our heart, like we said, one heart, so beta 1. Beta 1 on the heart has the positive inotropic and chronotropic effects, so this would increase your heart rate. And 2 lungs, so beta 2 on my lungs. Now remember, sympathetic is your fight, flight, fright, right? You're running away from a tiger. You need to breathe in as much air as you can to support that physical activity, right? So you're using your lungs to full capacity. So this broncho dilates, right? So one of the good drugs for bronchodilation can be beta 2 agonists. Okay, blood vessels. Blood vessels, it's a little tricky Okay, because we have two opposing actions of the sympathetic branch on the blood vessels. We have alpha 1. Keep in mind this is a GQ. So GQ, calcium in the cell, contraction, right? So this vasoconstricts. But there's also beta 2, which is a GS. Remember, all the betas were GS. And this actually vasodilates my blood vessels. So I have opposing functions of two receptors that are within the sympathetic branch. So I have alpha 1 vasoconstrict and beta 2 vasodilates. Okay, coming to the bladder, we have beta 3. It's easy, right? You have M3 and beta 3. They're both the 3s in the bladder. Okay, and how you can remember that is you have 1 kidney, 2 kidneys in a bladder, and a total of 3, right? I don't know if that helps, but something small for you. Okay, so beta 3, now when you have a fight, flight, fright response and your sympathetic is taken over, it stops you from peeing, right? Imagine running away from a tiger. You don't want to take a stop on the way to stop and take a pee, right? So sympathetic stops you from peeing. This is beta 3. This relaxes the detrusor muscle so it can expand and hold on to more urine. Another sympathetic innervation that we see it on the internal urethral sphincter. Is alpha 1, which constricts my internal sphincter to prevent the outflow of urine. Okay, keep in mind, let's put this in orange. The external sphincter is under smooth muscle control. Sorry about that. It's under skeletal muscle control. And the nerve that sends this information is our pudendal nerve. Okay, so this is under voluntary control. You can control your external sphincter. Okay, moving on to our eye. The eye gets interesting with sympathetic, okay? You have 3 receptor types in the eye. You have alpha 1, you have alpha 2, and you have beta 2, okay? And what's interesting is alpha 1 is a GQ, alpha 2 is a GI, and beta 2 is a GS. So you have one of each type of receptor. I like to start with the GI and the GSs since I know that they're going to be opposing each other. So GS increases cyclic AMP, right? So it's actually going to help us increase production of aqueous humor. GI is going to do the opposite. It helps to decrease production of aqueous humor. So question here is, a pharmacology cue here would be someone has glaucoma. Would you want to increase the production of aqueous humor or decrease the production of aqueous humor? Well, you would want to decrease the production, right? So you would give an alpha 2 agonist, but you could also stop the production of aqueous humor, so you could give an antagonist for beta 2. Okay, so that's how you want to think about these receptor types. Okay, and then coming to alpha 1, remember it's GQ, so it's going to contract a muscle, right? So the muscle it contracts here is my dilator pupillae, which is this muscle here, the outer muscle. And remember that dilator pupillae, when this contracts, it dilates your pupils. It's called mydriasis. And you get big pupils. And another thing you're going to see with sympathetic is you're actually going to see a really long, tall, like long and skinny lens instead of a bulging lens, because a skinnier lens is better for far vision. And that should make sense if you're running away from a tiger or some kind of threat. You want to be able to look as far as you can with more, better visual acuity. Okay. And moving on to the kidney, there is one receptor we can talk about here. It's beta 1. Beta 1 helps to increase renin production. And if you know, renin is part of the RAS system, which helps bring up the blood pressure in the body. So you can remember that one. Okay, so that was our parasympathetic and sympathetic locations, receptor types, and the function. Let's just consider one last receptor type before we move on to catecholamines. So let's just look at dopamine, or the D1 receptor, which is a GS receptor. So dopamine also acts on the kidney. It acts on the renal mesenteric bed. Okay, it's the blood vessels it vasodilates in the renal mesenteric bed, and you have more blood going to the kidney. Remember, more blood going to the kidney can also increase your GFR, which can increase your urine output. So you want to remember D1 as vasodilation for in the renal mesenteric bed. D1 also vasodilates, and I'll put this here, your coronary arteries in the heart. But more specifically, we're going to be talking about renal mesenteric bed. Okay, so that is the location types and the functions. Talking about the catecholamines, and this should make sense now that you know the have some idea of the different receptor types. So talking about epinephrine, can turn on alpha 1, alpha 2, beta 1, and beta 2 receptors. Norepinephrine can turn on alpha 1, alpha 2, and beta 1. Okay, only. There's no beta 2 with norepinephrine. And dopamine can turn on D1, D1, beta 1, and alpha 1. Okay, so let's talk about epinephrine. There's something pretty unique here. There's alpha 1 and beta 2 that can be both activated by epinephrine. Now it's interesting because alpha 1 vasoconstricts, beta 2 vasodilates, right? So what is epinephrine going to do? Well, that depends on the dosage of epinephrine, okay? In low dose epinephrine, beta 2 is activated much strongly than alpha 1. And what we see vasodilation as the outcome. Remember, when we have vasodilation, this brings down my diastolic blood pressure, right? Because my vessels are dilated, the pressure of the blood goes down. When the blood pressure drops, or the diastolic blood pressure drops, we get a reflex. The brain sends sympathetic innervation to the heart. We actually get a reflex tachycardia. So what you're going to see in low dose epinephrine is a reflex tachycardia. It's always opposite. Blood pressure goes down, heart rate goes up, blood pressure goes up, heart rate goes down. Okay, so blood pressure drops, heart rate is going to go up as a reflex. Okay, talking about high dose epinephrine, alpha 1 receptors are more strongly activated than beta 2. This gives us vasoconstriction. Okay, and when you vasoconstrict, the blood pressure in the arteries goes up, your diastolic blood pressure goes up. And like I said, if blood pressure goes up, heart rate goes down. So you're going to get a reflex Brady. Okay, talking about norepinephrine, this is the easier one since we only have alpha 1 and we don't have anything to oppose it. So norepinephrine, just remember, it will always vasoconstrict. And when you vasoconstrict, let's just copy this right here. Blood pressure will go up and we'll see a reflex bradycardia. Okay, moving on to dopamine. Dopamine is similar to epinephrine. At different dosages, we see different responses. So let's do a low dose dopamine. Let's do moderate dose dopamine. And let's look at high dose. So at low dose dopamine, the receptor that's activated is D1. Okay, and if you remember, D1 does vasodilation of the renal mesenteric bed. Okay, this can help you eventually increase urine output by increasing GFR. At moderate dose dopamine, at moderate dose dopamine, we have beta 1 that's activated, okay? And beta 1, if you remember you have one heart, two lungs, so beta 1 is the one heart. It has a positive inotropic and chronotropic effect on your heart, okay? So this is going to increase your heart rate. Okay, and then high dose dopamine, it's alpha 1 that is activated, and what you see is you see vasoconstriction with alpha 1, diastolic blood pressure goes up, and you get reflex bradycardia. Okay, so that's how you want to remember just the basics of these catecholamines. So hopefully you enjoyed this video. Make sure you're good with these receptor types before you move on to learning any kind of pharmacology. I'm pretty sure this is going to help. Okay, thank you everyone for your time. See you in the next video.